This is Dr. Hesch from the Hesch Institute in Aurora, Colorado. I am a physical therapist, and my client describes pelvic asymmetry. And in looking at his pelvis, one could give it a name such as a left posterior ilium. The iliac shelf on the left side is lower, and the ischial tuberosity on the left is more subtle. I can't say that there's an asymmetry at the bottom of the sit bone. When he lays on his back, the anterior shelf on the left is higher, so it looks as though the ilium rotated on the left. However, if that was true, then there would be blocked mobility when I do a superior spring test, but there is good mobility. And so it doesn't fit the definition of what we call posterior ilium. It could be a developmental asymmetry of his pelvis, but I do note that when I test his lower pelvis, the midline of his body matches the midline crease of his pants, and when I come medial to the sit bone on each side, you can see that there's a lot more space on the left side, and on the right side that sit bone is very close to the midline. So I call this a lower left wind-swept pelvis. And when I try and spring the ischium on the left side, there is not free mobility. And when I come in scoop medial to the sit bone on the right side, there is no mobility there. And it's not going to move on in this direction based on past experience, and that's true. And this will not move laterally. So he has really good mobility on the upper pelvis, good mobility in inferior glide, good mobility on the right side, and good mobility with rotation. When I spring the sacrum, it moves very freely. I can see the force translate all the way down, and I can see his heels move. So the only motion restriction we have is in the lower pelvis. Now there might be a subtle asymmetry in terms of his internal and external rotation, and there might be a subtle asymmetry in terms of ab and adduction. And there might be a subtle difference, a side-to-side difference in strength of those muscles that we just mentioned, of the muscles that are active in those movements. But I'm going to stop filming now. I just wanted to show his presentation, and I see this pattern somewhat regularly, and it's for that reason that I wish to document cases of this presentation. In another video on YouTube, I show how it is treated, and so I'm not going to cover that in this video, but I will show his response to treatment. And that'll be part 2. Thank you.